If my friend were to take this class, I would recommend already taking at least one A&P class beforehand. This really helps you better understand what we are talking about. The second thing I would recommend is spacing the work throughout the week so you're not doing everything the last minute. The third thing that I would recommend is making flashcards for the words that are harder to remember and studying for about 15 minutes a day. In this video, I will be talking about the 6 systems and some of the diseases and terms that are used in these systems. The first one I will be talking about is the skeletal system. Ankylosis means the loss or absence of mobility in a joint due to a disease, injury, or surgical procedure. The prefix ANKYL means crooked, bent, or stiff, and osis is abnormal condition or disease. Ankylosing spondylitis is a type of arthritis that causes inflammation between the joints. Ankylosing is the stiffening that leads to ankylosis, the loss or the absence of mobility of a joint. The spondyle means vertebrae, and itis means inflammation. The third word that I want to talk about in the skeletal system is arthrosclerosis, which is the stiffening of joints. Arthro means joint, and sclerosis means abnormal hardening. The second system I will be talking about is the muscular system. Abduction is the arm or the leg moving away from the midline. The way that I remember this one is being taken away. Your limb is being taken away from the midline. Pronation is the act of rotating the arm or the leg so that the palm of the hand or the sole of the foot is turned downward. I remember this because your hand is pouring a bowl of soup. Supination is the act of rotation of the arm or the leg so that the palm of the hand or the foot is turned forward or upward. I remember this by saying my hand is holding a bowl of soup. Striated means striped. This is normally found in muscles like the voluntary muscles of the skeletal system. I remember this one because it reminds me of stripes of a zebra or strings inside the muscle. Striped, striated string. Tenosynoviitis is the inflammation of the sheath around the tendon. The next system I will be talking about is the cardiovascular system. Arteriosclerosis is the hardening or narrowing of arteries. This is caused by the buildup of cholesterol plaque on the interior walls of the arteries. Artho is the plaque or fatty substance. Sclerosis is the abnormal hardening. Hypoglycemia is the low levels of glucose in the blood. The way that I remember this one is because of the G, which stands for glucose, and the emia, which stands for blood. Hemangioma is the benign tumor made up of newly formed blood vessels. Heme means blood, angi means blood or lymph vessels. The next system I will be talking about is the lymphatic system. Hyperlipidemia are elevated levels of cholesterol. Hyper means excessive, lipid means fat, emia means condition. I remember this because of cholesterol is fat, and hyper means high or excessive. Lymphadenopathy is the disease process affecting the lymph nodes or nodes. I remember this one because of the prefix lymph, and that lymph means lymph node. Metastasize is to spread from one place to another, normally meaning cancer. I remember this one by moving, meta, M and M. The next system I will be talking about is the respiratory system. The nasopharynx is posterior to the nasal cavity and continues downward behind the mouth. Air only passes through the nasopharynx. Naso means nose and pharynx means throat. The oropharynx is the portion of the pharynx that is visible to the mouth. I remember this one because oro means mouth, and that when the mouth is open, it makes an O. Laryngopharynx is the third part of the pharynx and is shared by the respiratory and digestive system. I remember this one because it is the third part of the pharynx and that the food, air, and fluid passes through it. Third part of the pharynx, 3 things pass through it. The next system I will be talking about is the digestive system. Diverticulitis is the inflammation or infection of one or more diverticula in the colon. Gastroduodenostomy is the establishment of an anastomosis between the upper portion of the stomach and the duodenum of the small intestine. The last and final system I will be talking about is the urinary system. Hyperproteinuria is abnormally high concentrations of protein in the urine. Hyper means excessive, protein means protein, and ura means urine. I remember this because of the P for protein in the medical term. For how much or little protein is in the urine, I look at the prefix. All of the terms that I explained have to do with the field that I'm going into because I'm not just focusing on one part of the body, but all of it. The human body works as a whole, and if one system is not functioning properly, the others will be working a lot harder to try and compensate for the one system. I'm going into the ICU, so I will have to be able to identify most of these terms, signs, and symptoms of these diseases and issues that could go wrong with the body.